My name is Jake Drucker. I'm from Long Island, New York, and I'm an agitator for the New England Wolves in the EHL. At home, it's always been me, my mom, my dad, and my brother. My mother's always been there as a good support system for me. And growing up, my dad is the one who introduced me to hockey. I almost learned how to skate before I learned how to walk. He always used to tell me, the worst day in the ice is better than the best day off the ice. Long Island's not very big. It's 75 miles wide, only 15 miles north-south. So it's a very small geographical footprint, so you're not really exposed to much else. So as a hockey player, you gotta move out if you wanna move on. When I was growing up, there was one particular player that I loved watching, and it was a guy named Sean Avery. I think you can call him like the master agitator. He faced the goalie while the play was going on, trash talking, and he took his stick like this, waved it like a wand in front of his face, and you could see the goalie freaking out. It's like watching art. And I've really developed the agitator like persona. My job is to try to get under the skin of their best players. For me, it's get over that middle line, dump the puck in so that their defenseman can get it. But little does he know, the little 5'6" runt's gonna run him from behind into the glass and try to break his nose in the wall. Things were going great for me. I was out there playing every day, throwing bodies around, doing my thing. And for me, that just felt really, really good. I was in the top of the world. I signed with the team. I was ready to go. Nothing could hurt me. I felt omnipotent. Like, I was fine. It was almost euphoric. And then everything changed when I took this trip up to upstate New York to visit some family up there. And when I got there, I woke up the next day with this insatiable pain in my leg. I didn't know what it was, but all I knew was it had to be addressed because this was not right. I went to a minute clinic up there in Emergicare, small little place. They told me it's what we call bursitis, which is a very minor, very benign ailment that you shouldn't worry about. Just keep off it. The x-ray is not worth the $50. So 2 weeks passed, and I said the pain started to really, really increase. So I decided enough's enough. I gotta go to a real doctor. So I went to a sports orthopedist. Went in there thinking maybe it's a little something more than bursitis, but what can it really be? Waiting in the waiting room for the doctor to come back, tell me the results. So he came in, I'm all smiles. He looked at me, paused, put his hand on my shoulder like that. I looked up, I was like, what? What is this? And he goes, Jake, I'm really sorry, but you have a tumor, and I don't know if it's cancerous or not. The second thing I remember from that, he gave me this card, and it was a doctor's name, Dr. Wong of Montefiore Medical Center. And in big print, it just said like, boom, oncology. And once you see oncology, now it's like, whoa, just cancer.
I met Jake and his parents in May of 2017. And at the time, he has seen an outside physician. At that point, he didn't know what to expect. Jake had a type of tumor that can cause damage to the bone. And oftentimes in athletes, they put a lot of stress on their bone, playing, and the bone can fracture. I told him and his parents that we have to do a biopsy, a small surgical procedure that would be used to take a sample of the tumor to have it tested. And that usually make the diagnosis right there.
The first thing I noticed, they had a very calming presence there. They had a very particular bedside manner, which is not something that you think as the top attribute of a doctor that you're looking for. But once you receive that tender care and like love for all intents and purposes, you get a different perspective on it. You feel a little bit better, which is a huge plus. And then I got pretty much the best news of my life. It's not cancerous, but you need to take it out.
After we ascertained that it is benign through a biopsy, I had Jake and his parents come back to the office to discuss with them the results. And in Jake's case, since we feel that his tumor has caused pain, that's the best thing to do is to prevent any further injury. So we did a procedure called a curettage and bone grafting. So in order to treat it, you need to not only remove the tumor out of the bone, but also to put some bone back in there to try to make the bone stronger so that he can go back to whatever he was doing before.
It was game time. It all came down to this. So I went in there, we were all pretty nervous, we didn't know what to expect. Dr. Wong said, no, we're administering the anesthetic, and that's the last thing I remember. Everything went green and boom, done. I was out like a light, that was it. So I woke up from the surgery and I can remember it like clear as day right now. The first thing I thought about was, when am I getting on the ice? That was the first thing I thought of. Things were going great for me. I was out there playing every day, doing my thing. I get a text from a coach of NYU. They said, we'd love for you to come see our campus down in New York. My parents were so proud of me. My dad would call me once a week and tell me, like, I'm so proud of you, son. Like, you're really making me happy. And for me, that just felt really, really good. So we had a game on a Friday up in Walpole, Massachusetts. I went up there, played the game. The thing is that the rink itself had very poor cell service, so I wasn't getting any notifications on my phone or anything like that. So I was walking out of the ring, joking around my buddies, haha, whatever it is. I pick up the phone, I call my mom. She tells me, like, are you alone right now? I said, yeah. She goes, I got some bad news. I said, what is it? She goes, I'm really sorry, Jake, but your dad died of a heart attack tonight. And at that point, it was the same deafening feeling that I felt when I heard the word tumor. It was just this dark parking lot. I have this horrible news, and I'm just alone in this cold little town in Massachusetts. And I kind of just stared off in the distance, try to absorb everything. Because I just triumphed over so much in the past year. Everything I've gone through, it was always, hard work. Hard work will get you places. If you work hard enough, you can beat any circumstance. But this was different because as hard as I work, it couldn't bring him back.
Hey, Jay, how you doing?
Hi, good.
Good. Have a seat. So how you been doing?
Good, not too bad.
Yeah.
Things are going well.
It's always difficult to predict who and when an athlete's going to get back to their full form. All right, I'm just going to listen to your heart, okay? The good thing about Jake is he's young, he's very motivated, and I felt that after treatment, some help with physical therapy, that he would be able to get back to some level of playing. Deep breath. That's great. It's always, difficult to say from the outset, but, that's what we strive for. He is doing fantastic, and he is even at a level better than before. Having said that, I think that he came out of this experience a stronger person, and I think that has to come from within. And so in Jake's case, I think that he's going to do very, very well.
For me, I've gone through so many hardships, so many things that have really changed the mold, the shape of who I am as a person. But in this moment, now, I'm not just hungry, I'm belligerently starving. start taking things in perspective a little more, like this could be my last day, this could be my last year doing this, last holiday doing that, things start to really become vivid, almost surreal. So that's when I said, okay, I can do this. Like, nothing can beat me. Even the scare of cancer. It doesn't matter who you are, what your circumstance is. If you put that work ethic in, you work hard enough, you can achieve anything in this world.